Continuing with our second part of the health and diseases videos, we've got to look into oral disease, colon health, and osteoporosis this time. How do you help? How do you prevent? And how do you deal? Let's start off with oral disease. Now, when you start thinking oral, it's really more than just teeth and gums. It's also all the supporting aspects. Think ligaments and nerves and bone. They all play into oral health in general. Really, your oral health can have an impact on your overall body health. So it's not just your mouth, but the rest of your entire body can be impacted by what your oral health actually is. Because there's bacteria in your mouth. They're supposed to be there, it's natural. But those bacteria are going to take fermentable sugars and metabolize them. Well, when they metabolize these sugars, they're creating acid. That acid can erode the enamel on your teeth. By eroding the enamel, that can make little holes or little pockets. Those can then become filled with bacteria and become cavities. Now, I'm willing to bet most people have heard cavities aren't good, but the question is why? By having those bacteria growing inside the enamel can keep spreading out and eroding the enamel further. Plus, they can keep boring down into the center of the tooth, potentially reaching the very sensitive nerve in there. So it's really not great to have cavities building up in teeth. But also, the gums can be impacted by bacteria as well. Think of gingivitis. The actual bacteria is growing and separating the gums and the actual teeth, allowing more bacteria to get even deeper and deeper. Now, this can grow into a really serious problem in the overall body health because it can impact your cardiovascular system. What ends up happening is if enough bacteria get down in between the teeth and gums and start getting down into the bloodstream, that bacteria can flow throughout the entire body. But a lot of times, they'll end up targeting your heart valves and the vessels around the heart. By damaging those enough, it can start causing problems with the heart, as well as blood pressure and blood flow problems. So really, it's not just oral health, it's overall body health here. So where do these fermentable sugars come from that the bacteria in your mouth will look and use? Main sources: soft drinks, sports drinks, candy, dessert, and fruit juices. Now you say, well, sports drinks is great to help me replenish after exercise. True, but is it really necessary for the exercise being done? If it's 15, 20, 30 minutes, you're not sweating that much, probably don't need that energy drink. Those sports drinks, those energy drinks, they're really meant to help replenish, especially the sports drinks, I should say, are meant to replenish the electrolytes if you've had a lot of sweating at a high exertion. Even then, they're not always necessary. Depends on what's going on and what's happening. But really, cavities are typically associated with more of a poor diet, just based on where those sugars usually are found. So oral disease, more than just your mouth, it's the entire body, especially impacting cardiovascular. Next one is colon health. Well, colon or large intestines. You can greatly aid the colon health by simply ingesting fiber, a lot of times found in whole foods. But if you want to get more specific, it's really the insoluble fiber found in the whole grains. Now, this fiber can help to prevent diverticulitis. Now, diverticulitis is defined as a deficiency of whole grain fiber. So pretty much, don't have whole grain fiber causes problems throughout the GI tract, specifically the colon or large intestines. What diverticulitis actually is, as well as the large intestine goes, is going to be out pouches, kind of like to cause the membrane to pouch out or create these cavities that push out of the large intestines. Those out pouches can then become inflamed. Because think about your large intestine, your colon. It's meant to take all the components that you can't digest and they get mixed with all the bacteria that normally lives there, plus any that you brought down. And then all this is a waste product. If you have pouches out of your colon where things get packed into, they don't leave. They just get stuck in there. The bacteria can grow and really start to cause some problems, hence the inflammation. Symptoms can go anywhere from abdominal pain, nausea, alternating back and forth diarrhea or constipation, depending on what's happening at the time in that state of diverticulitis. Constant fiber really is the key. Constant fiber intake can prevent diverticulitis. And this is one of those things that's been shown in numerous different studies at this point. They know that fiber is going to help. The reason it helps is the fiber will break down in the colon, so in your large intestines. It's actually the bacteria that are breaking it down. Once they break it down, it releases short-chain fatty acids. These short-chain fatty acids are going to provide nourishment to your colonic cells. So basically the cells lining the large intestines. So by providing them nourishment, it can help keep them healthy and can inhibit inflammation. But also, if that wasn't enough, they're looking into how it may reduce cancer risk as well. Because it constantly keeps things moving through, less chance for the cells to become damaged and to mutate into a cancerous cell. Now, it hasn't been fully proven yet, this kind of ongoing research, but the things are looking and leaning towards it being concluded shortly. All right, that's colon health. Basically, eat your fiber. Last but not least in this video and this part 2 of the health and diseases is osteoporosis. Osteoporosis is excessive loss of bone over time. It's not going to happen overnight. We're talking through years. But there's many factors that contribute to osteoporosis. Reduction in hormones, decreased calcium absorption, increased muscle deterioration can all impact osteoporosis. Well, reduction in calcium absorption, sure, not enough calcium to keep the bone solid. Increased muscle deterioration. The muscles aren't pulling enough, therefore not enough stress in the bones. The bones think, hey, you know what? We can become weaker. We don't need this much strength. The idea is basically trying to maintain your bones, but you don't have all the necessary parts and pieces. That's osteoporosis. You don't have the muscles creating the tension. You don't have enough calcium to build up the strong bones. You don't have the right balance of hormones to trigger the bone growth or bone remodeling. But you can try and minimize the impact of osteoporosis through diet and exercise. Healthy diet, vitamin D and calcium, can help to alleviate the calcium basic absorption problems. Exercise, by being weight-bearing exercise, can help to put stress on the bones. Again, not too much stress, just a little bit of stress to say, hey, you're still needed. Keep your density. But even at that case, it really goes back down to children. Because bone growth is primarily happening from infancy up through adolescence into puberty. Now, once you pass puberty, there's not a whole lot of bone growth going on, a little bit. By age 20, typically bone growth is fairly complete. In your 20s, you might get a little bit of a bone mass increase, maybe 10% at most, but really it's done by the time you hit 20. By 40, you start that slow decline of bone mass, unfortunately. Now, you won't necessarily notice it, but it's a slow process that can take decades to go through. This bone loss is really because the calcium resorption is outpacing the deposits, which means you're taking more calcium out than you're putting into the bones. I mean, your bones, your entire life, are remodeling. But if you're taking more out than putting in, and it's not a balance, they'll slowly start losing mass. What's happening is the trabeculae, these little tiny bridges, are lines in the bones. These trabeculae get thinner and thinner, which means there's more spaces, more not calcified spaces. The bones become weaker. Risk factors. Well, reduced physical activity is a risk factor because by reducing physical activity, you're not putting the stress on the bones. Not putting the stress on the bones, they don't try to maintain the bone mass. Pretty much activity increases osteoblast activity. Osteoblasts are the cells that put down the calcium. So if you're not triggering those, you're not putting calcium down. Being underweight. You're saying, well, underweight. If you're underweight, a lot of times you have a smaller frame size. Smaller frame size means less bone mass to start with. Less bone mass to start with means even smaller deteriorations in the future can become problematic. Smoking, alcohol, caffeine. Now, in the case of smoking, it's kind of hard to tell 100% if it is impacting osteoporosis directly, because a lot of times smokers are less active and have a poorer diet. So they're not really sure which one of these are playing a part there. Alcohol and caffeine, those two, take your pick. They might be, they might not be. There's research showing that there is a positive impact, but also research showing there's a negative impact for both. So that one's kind of an up in the air, needs more research. But nutrition, that one, hands down, tons of research tells you vitamin D and calcium are important. So making sure you have plenty of calcium in the diet, but making sure there's plenty of vitamin D with that calcium, because you need the vitamin D to absorb the calcium into the GI tract. So really, nutrition again comes down to play here. Better bone mass to start with is better bone mass later in life, because having more bone mass to start with means more degradation can occur before it becomes problematic. So try and make sure in childhood, plenty of calcium, plenty of vitamin D to build up those strong bones. Until the next video.